So, thank you everyone for coming. We have a fantastic opportunity today to start thinking about shaping the future of digital health and how IMI can help bring about that change. As Cole mentioned, I sit and lead a group called Data and Knowledge Management SDG. Over the last 5 years, colleagues and I have been looking at how we steer the investments that the IMI group make into digital technology. And we've seen the transformation around knowledge management, around data sharing, and we've made some progress there. What I'd like to do today is really start to look at where we're trying to go next. And I think, for me, this journey actually starts pretty much 20 years ago. 20 years ago, I was a first-year undergraduate, Warwick University, studying computer science. Just 20 years ago. What were we taught in our first week as undergraduate studies as computer scientists? How to use the Netscape web browser. 20 years from teaching our computer scientists, people who knew how to use computers, how to use the internet, to my 4-year-old son being baffled by the fact that he couldn't watch BBC CBeebies channels on an iPad at any time when our router went down in recent thunderstorms. 20 years to 4-year-olds expecting the internet, to us computer scientists wanting to be taught how to use it. That's an amazing change. The internet has changed so much in 20 years. And it's continuing to change. We've seen not just the internet itself, but the post-PC era. We're all carrying with us a smartphone that is more powerful than the computing technology that ran the Apollo program. We're not just, we have our smartphones, we use them for recording videos of cats on skateboards. We use them for diagnosing disease. And we have to figure out how to make this work. And it isn't just mobile phones. Over the last 3 weeks, Apple announced 2 new wearables. A wearable for your wrist, a wearable for your ear. Computers are now moving out of the phone and trying to find other bits of real estate. How do we understand how to use these in the context of healthcare? And this is generating volumes of data on an unprecedented level. From the Fitbit I wear, generating data about my behavior on a daily basis, from the interactions I use with my credit card, to how I use my cell phone and where I use it, to the genomics I'm able to get profiled for me for less than $1,000. We're generating terabytes, gigabytes, petabytes of data. And that's causing us to think about data science as a new way. I studied for my PhD machine learning and high-performance computing. We'd call that big data today. And when I started, data sciences wasn't a career. Now it's one of the hottest careers out there. And so the world has changed in those last 20 years. And sometimes it's worth taking a step back and just thinking about that. Where this first came important to healthcare for me was when I actually saw a talk in 2012, a TED talk by a professor at Aston called Max Little, who set up a project called Parkinson's Voice. And his interest as an applied mathematician was understanding how to enroll Parkinson's patients in a voice sample. Sorry, he wanted to do voice analytics on patient groups. Because he saw that if the diagnostic capabilities at the time involved going to a neurologist who could run a series of non-invasive tests that were very accurate. But if he were to leverage technology and create a voice test that was based on recording using telephone technology, you could create a test that was non-invasive. The telephone infrastructure existed. It was accurate. So all the benefits of meeting a neurologist, but it was also remote, could be run by non-experts, was high speed, ultra low cost, and scalable. And I think the key statistic was that the test was eligible for 750 million people. Now, we run clinical trials every day at Janssen. The ability to get to have an addressable population of 750 million people is completely phenomenal. It's groundbreaking. So that is the difference technology makes in terms of scale, in terms of opportunity, in terms of being able to transform medical research. This isn't about trying to get 30 patients into a doctor's office. This is about getting billions of patients to connect and interact with research technologies. So the IMI has been investing in these technologies, as I said, over the last 5 years. It's worth just taking a brief look at what we have delivered, because there have been some fairly phenomenal achievements that we've made today. The first project I'd like to highlight is WebRadar. Speakers from WebRadar are here, and we'll talk about it further, but we asked the question, what does mobile technology and social media technology mean to pharmacovigilance? How can drug safety research be changed and transformed with everyone carrying a computer and everyone communicating with everyone on social media? So we invested in social technology, we invested in mobile technology. We took this a step further with the recently launched RADAR-CNS project, who just launched their new website, so I shall highlight that here today. This is the question about how one can use wearables, wearables and mobile technology to understand behavior that helps us better understand and characterize neurological disorders, such as depression, multiple sclerosis, and epilepsy. So this is really the wearables project. If WebRadar started with mobile and social, I see this as the wearables project. An area that's been a very interesting topic over the last couple of years is the use of real-world data, the big data that is stored in the healthcare system. And IMI has actually had a trio of projects that have been evolving. The first was our electronic health records for clinical research, a project that was able to start exploring, could we access data from clinical research, from medical hospitals' databases. EMIF took that a step further and formed the European Medical Informatics Framework. And recently we've launched a very large program called Big Data for Better Outcomes. Big Data for Better Outcomes is a multi-project program. It focuses on the design of standard outcomes and demonstration of value, the access to high-quality outcomes data from sources from healthcare systems, from payer systems, the use of that data to improve value in terms of healthcare delivery, and increasing patient engagement through digital solutions. Essentially, how do we start to transform healthcare research and outcomes research, leveraging all of the data that's collected about patients in a structured way, in a secure way, in an ethical way? We've focused this in terms of Alzheimer's disease, in terms of hematological malignancies, the Harmony project, cardiovascular projects that are coming downstream, and we have a whole stream of projects going forward. We're also looking at how we can transform the models by which data is shared amongst healthcare professionals across Europe with the European Distributed Data Network. So this as a program is going forward. And finally, when we think about genomic medicine translational research, the ETRIX project was a unique project that it was set up to support other IMI projects. And so in the course of its 4 years, it supported 40 other public-private partnerships. What that meant is it's helped people manage their genomic data, their omic data, their clinical data in new ways. It's released 9 new open source tools. It's enabled and trained 350 researchers across Europe in how to use their data more effectively and get more value out of their data, and has created to date 58 public data sets. So from genomics, from real-world data, from wearables to social media, the IMI has been looking at how it can use technology to change medicines research. So here we are today, 2016, 20 years ago, almost just under half my lifetime, still just under by about 3 weeks. The technology has transformed everything. But really, that's nothing compared to the disruption and the transformation that is going on today. And the setting I'd like to set is how do we move forward? What should we be doing? And in order to stimulate that, I thought I would try and attempt to be a futurologist for a few moments and try to think about what technology looks like in 10 years' time, which is hard. So let's look at what technology was like this year. The biggest trend this year was Pokemon Go. We've got mobile, we've got sensors, we've got augmented reality, we've got gaming, we've got geocaching. Is it a game? Is it healthcare? We started seeing reports about getting people who are essentially sedentary out and walking more than they'd ever done before, kilometres and kilometres a day as they chased down cartoon characters that were distributed amongst cities in this world. I mean, I think we have to ask ourselves, is gamification, is engagement, is it a game, is it healthcare? And that's where we are today. Where is this technology going to take us? Another big announcement this year was Google's DeepMind beating AlphaGo. Google's DeepMind's AlphaGo beating Lisa Doll, the 9th Dan Go champion. So let's just think about AI over the last few years. 1997, IBM's Deep Blue computer beat Garry Kasparov. We watched this at university. 2011, IBM's Watson beats Jeopardy, and then this year we had AlphaGo. The AI and machine learning renaissance is upon us. Breakthroughs in deep learning, breakthroughs in GPU computing, the simple scale of what we're able to do with the amount of data is transforming the decisions a computer can make. So the question to all of us is, how can we safely and ethically use this in the future of medicine? I think the opportunities from everything from virtual clinical trials to virtual diagnosis is amazing, but how can we actually test that? How can we use that? How can we make a difference with this technology? But we're on an exponential curve, and I think that's what's important. So I started plotting the LINPACK scores. This is a metric of how many raw computations a computer is able to do. And I tried to just plot some statistics about just the peak performance of these computers. And as you can see, the DeepMind barely even shows up when compared to AlphaGo on a linear scale. So we'll plot it on a log scale. And we're going from essentially 10 to the 10 computations in 97 through to 10 to the 14 computations, in normally 4 logs of transformation over the last 10 years or so. We're on an exponential curve, and as humans, we're really very poor at thinking exponentially. But if we continue this rate in 10 years' time, in 5 years' time, our computers are going to be, again, several orders of magnitude, several logs more powerful than we can do today, with data being generated at several logs more orders of magnitude powerful today. So it's very hard to predict what we'll be able to do with that. And that's the question we're actually asking you today is, if we started a project in IMI today, next year, it will run for 5 years. We have to think about things that are transformative over a 5 to 10 year scale. And those are the types of questions that are hard to ask. They're easy to ask, but hard to answer. And that's why I'm up here asking it, and I'm asking all of you for your input on this. But these are what we're trying to work through. And so finally, let's just conclude on one last slide. What will healthcare look like in a world that has 8 billion connected people? 2025, predictions about 2025, 8 billion connected people with drones flying overhead, meaning that we're able to connect to wireless networks wherever we are in the world, 1 trillion connected sensors. So if we think about the Internet of Things today, predictions are from Gartner and others that we'll have 1 trillion connected sensors recording data about everything from industrial control and transportation to ourselves with embedded sensors measuring our health and our physiology. So I coined 2 expressions in an internal workshop. Software as a diagnostic. Software is eating the world. How do we have software as a diagnostic? How do we have software as a therapy? What is software as a therapy? As technologists, how do we transform software, transform technology into these capabilities? So really, I'm going to pause here. And as Colm said, we welcome you all here. We welcome your input. This is a forum where we get your input to help try and drive the strategy the IMI takes going forward. And I will pass back to Colm to introduce the next session. Thank you.